Hello, this is Dr. Grande. Today's question is, what is the nature of stigma as it relates to social anxiety disorder? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about social anxiety disorder, we're talking about a mental disorder listed in the Diagnostic and Statistical Manual, and we see several different symptoms with this disorder. What we expect to see usually is a fear or anxiety in social situations, a fear of negative evaluation. And we see here that social situations are avoided or they're endured with intense fear and anxiety. So social anxiety disorder carries a lot of consequences for an individual who has it, a lot of negative consequences. Now, we know that social anxiety disorder does carry a stigma, and there have been several articles that have talked about this in one way or another. A couple that I used for this video were Feldman and colleague 2007 and Anderson and colleagues 2015. Now, when we look at the definition of stigma, there are actually many definitions available, and stigma is a hard construct to study accurately. One definition would be that stigma is distinguishing individuals as different and labeling them in an effort to create social distance. So really, we relate stigma to social distance. This idea of social distance or a desire to create social distance is a lot easier to measure than the construct of stigma. So oftentimes when we talk about stigma, we're really talking about this degree of wanting social distance. We know that with social anxiety disorder, about 80% of individuals who have this disorder won't receive treatment. Now, if we look at major depressive disorder as a comparison, about 40% of individuals with major depressive disorder won't receive treatment. So we see that with social anxiety disorder, not receiving treatment seems to be a major problem. And we believe that stigma is partially to blame here. We can't look at this factor and say it's entirely attributable to stigma, but still we know that it plays a part, and reducing stigma would probably encourage more people with social anxiety disorder to receive treatment. Now, when we look at mental illness and stigma in general, we know a few different things. The perception of certain dimensions, the perception of certain constructs, is associated with the desire to create more social distance, specifically dangerousness, personal responsibility, and rarity. So dangerousness comes down to this idea that mental disorders have some sort of association with violence. Now, we know that there are a few mental disorders which carry a greater risk of violence, but in general, for the vast majority of mental disorders, the risk of violence is the same whether somebody has a mental disorder or not. So really, there's this perception of dangerousness that's not accurate. And this is really the largest factor in predicting if somebody wants to create social distance between an individual with a mental disorder, this perception of dangerousness. Now, with the perception of personal responsibility, what this means is that if an individual looks at an individual with a mental disorder and believes that they caused it, that they chose to have the mental disorder, or they engaged in activities that were almost certainly going to result in the development of a mental disorder, then there's this desire to create more social distance. There's more stigma. Now, with some mental disorders, this factor seems to play a greater role, like substance use disorder. A number of individuals in the public look at substance use disorder, and it's clear to see the behaviors an individual took that contributed to that disorder. Other disorders are thought of as really not having any personal responsibility component. So this really varies a lot depending on what mental disorder we're talking about. In general, there are of course activities that individuals can engage in which increase the risk of developing some mental disorders. And other mental disorders, it's difficult to identify any activities that somebody can engage in that would increase or in some cases even decrease that risk. They just don't seem to be tied to environmental factors as strongly. But either way, regardless of how we perceive individuals' behaviors and the development of mental disorders, to what extent we think that really happens, the perception of personal responsibility is still there, and this leads to a desire for greater social distance. I view this factor of personal responsibility similar to the factor of dangerousness, in that there isn't really much of an association between the constructs, like mental disorders and dangerousness, or mental disorders and personal responsibility. Yes, there are some associations with some mental disorders, but the perception that a lot of people have is that there's a very strong connection with those constructs, and I think this, of course, leads to part of the problem. The last factor is rarity. So what this means is if an individual views a mental disorder as less common, they're more likely to want to create social distance. Now we know with dangerousness and personal responsibility, there's inaccurate information. These perceptions are incorrect. We think the same thing happens with rarity, that people view mental disorders as much less common than they really are. So what about the factors that contribute to stigma specifically with social anxiety disorder? Well, interestingly, we know that social anxiety disorder is actually one of the least stigmatized mental disorders. That doesn't mean the consequences of the stigma associated with it aren't severe. They are. But compared to a number of other mental disorders, social anxiety disorder just doesn't have the same level of stigma associated with it. Now, when we look at the 2015 study I mentioned, Anderson and colleagues, we see that they studied specifically social anxiety disorder, major depressive disorder, and mental illness in general. And what they found is when individuals perceive certain symptoms, that increases the social distance they want to create, specifically with social anxiety disorder. So these factors were when individuals viewed the symptoms as more avoidable, more common in women, and more likely to lead to work difficulties. That predicted greater social distance with social anxiety disorder. Interestingly, those factors did not predict greater social distance with major depressive disorder. We also saw that overall, there was a greater preference for social distance associated with major depressive disorder than for social anxiety disorder. And also, personal responsibility was not a predictor of social distance with social anxiety disorder, major depressive disorder, or mental illness in general. So this was a different finding than we saw in that earlier study in 2007. Now, there are also differences that were found across gender. So women had less stigmatizing attitudes in general about mental illness, and they tended to view mental illness as more common and more treatable than men. However, women also viewed mental illnesses as more severe than men viewed them. So some interesting differences between men and women in terms of how they see mental illness. Also, individuals who had been treated for mental illness before wanted less social distance with social anxiety disorder, depression, and mental illness in general. So this really supports the idea that familiarity with mental illness decreases the desire for social distance. So how can we apply the findings from these studies and other similar studies? Well, the first kind of obvious area is this perception of dangerousness. And again, I talked about this before, but we need to get more accurate information about the low risk levels that are actually associated with mental disorders. This idea of individuals with mental disorders being more dangerous is harmful and contributes to stigma. Another area is, as a mental health treatment community, we need to acknowledge the consequences of stigma. There are real consequences associated with it, including difficulties in social relationships, with work, and of course we believe it contributes to interfering with treatment. And this is a particular problem, as I mentioned before, with social anxiety disorder. So we need more education and more awareness, and also we need to continue research on stigma, mental disorders in general, and specifically social anxiety disorder. I hope you found this description of social anxiety disorder and stigma to be interesting. Thanks for watching.